especially I must.
Which happening?
I kids, baby. Hey, yo, fam, what's up? My name is Kevin. Welcome to Kevin News. So I'm here with Lethabile. Hello.
Hello.
How are you?
Sharp.
So Lethabile is a final year nursing student, ne? She was saying final year part 1. Because you know the vibes, you know the current situations, we don't know what's going to happen with the year. But yeah, so she's doing nursing. We're going to be talking about that. So since we're in the middle of a pandemic, ne? You guys are also going to block. You call it block, or you just call it clinics?
Clinicals.
You guys are still going to clinicals. Don't you have like that fear and anxiety?
Yo, we do have, because even for example, our nearest hospital, most affected staff or most exposed, or those who have tested positive is the nursing staff, majority. So, and you know that we need to maintain patient confidentiality, which means that we have to be as close as possible with the patients and with the staff discussing. So it becomes a problem because right now, I don't sure.
So it's fear all over.
Fear all over. Like I was like now when you go to the hospital, it's not about job exposure in the hospital. Yo, it's more about what if. I guess the thing. It's
about you. Wouldn't you say that's like a challenge to that oath that you take? Very hypocrite. What?
It is. So.
Oh. So it's understandable for you guys to be scared, to be okay. So you know how Kayona Corona but Pelava credited doctor, like when it's time to respect people or frontline workers. No one talks about nurses. They don't talk about nurses. I saw a post. I see posts. They don't talk about nurses. I see it's not even about the pandemic. Everywhere, like every year, when it's time to talk about health and health professionals, respectable health professionals, no one talks about nurses. What, like how do you guys deal with that? Are you guys used to it? Have you accepted it? Like, do they teach you how to cope with it? Like, or you just get in there and not be acknowledged and get used to it?
You get used to it. Now what I've learned from my observation, people don't like nurses.
People don't like nurses. I think I know why. I think I know why. I also wanted to ask you about that. Why are nurses so rude? Why?
No, this thing, let me tell you, not in the hospital or since I've learned that this thing is individualized. It's at an individual level. And then there are doctors that are rude, or there are physiotherapists that are rude. So I don't know, maybe it's because the nurses key primary contact with the client. So I feel like maybe the frustration or overwhelmed in the
so workload they didn't step by their moods, and also not all of them, some individuals. But yeah, from a general perspective, I would say it's a lot of them. It's not all of them, but it's a lot of them.
Yeah, that's not fair. There are people there are rude doctors in the hospital. I can say if I sang government, they are rude. People there. So yeah.
So the gender imbalance, nursing. You know, when I say nurse, I think of a female person. Why though? Like,
Khali, nursing is one of the first people who are nursing. Nearly, Florence Nightingale. Yeah, and then like Toma Yaba, but now I think it's even bad to this thing. Gender imbalance.
So we must blame it on Florence.
Not really, but like I can say, yeah.
So what about the male nurses? What are the people?
And then like
soft. So it makes sense already. What? Is that what you're saying? Are you saying it makes sense for Basadi even in nursing because Basadi are carrying?
Yeah, we are carrying. We have that love.
Oh, so
that
this thing
compassion.
it's systematically. It's
No.
systematic. For nursing is supposed to be for women. Because I can tell you more women banally this thing, banally that.
You know, like the reason why,
care.
as you said, I sit about like there are only women. It's just that there are more women. I think in other fields there are many men.
Oh, yeah. So like nursing is that field. They don't worry. It's the contrary of other fields. Yeah, but okay, I got that. There's too many men. Here it's women.
Yeah, and you know, Urbana Barata Power man.
So,
no, like ban. No, that's not what I meant. But let's move.
Okay. Okay. Can I ask about you now with nursing? Growing up, did you always want to do nursing? Did you always want to be a nurse? No.
I wanted to be a medical doctor. No. So, grade 11, Iran, trigonometry. And so I got.
It was an academic challenge.
Yeah.
Okay,
but
so.
Anjiki, applying, you know, when you apply, you use grade 11 result. So when I got to matric, the marks were good, but like already applying, you get
I asked this because I see a lot of nurses baba experience like baba old. It's old people. Like majority of nurses is old people. So I'm trying to ask myself about the new generation and going into nursing. How do you think we can motivate them? How can we motivate them to get into nursing?
I think the younger generation right now. Okay, now what I want to do is to show them that nursing is not only about you can do more. People don't know what nursing is. They think nursing is just being there with the patient 7 o'clock in the morning, 7 o'clock in the evening. So now I want to show them that you know what, you can be something better. You can do something. To see. Yeah.
Are there specialties in nursing?
Yeah, actually a lot.
A lot. Can you like tell me one of the what are the requirements for someone to get into a specialty in nursing?
Firstly, you must be a professional nurse.
What's the
you mean from it?
Like no, after being you graduate, you become a professional nurse.
Yeah.
After how long are you then qualified to?
It depends. There are professional nurses with diplomas, those in colleges. I'm not sure if you know.
Yes.
And then there are us with honors degree. So you can, for us, you have to wait for 2 years. Okay, if you want to come back here, they said it's 2 years, and then from there you can do maybe psychiatry, advanced psychiatry, advanced midwifery, occupational health.
How long is it gonna take to complete that?
Masters is 2-3 years.
Okay. So yeah, what's the difference between, like you said, but nursing a diploma, nursing is it honors here? What's the difference there? It's practice. Is it practice?
Do you mean in
what's the difference between a nurse diploma and a nurse and honors?
It's just
what's
qualification.
But they do it like the exact same thing.
Yes, exactly the same thing. And if you take note, those from colleges have more experience. They have more knowledge on the practical.
So there's no difference in position when you get to the workplace. There's no worry. These ones give our hold. How?
We are here. The salaries are here.
So how long does it take to complete a diploma in nursing? 4 years. And then an honors 4 years. And then the I would say the academic workload, is it the same?
I don't think so. Ours is the degree has a lot of theory. The content is a bit deeper. And then those that side, but there are more of practical and then less of theory.
Yeah. But when you get to the workplace, different qualifications but same position. And
crazy.
Also it's crazy. And then you said specialty for you to come back here, you work for 2 years.
Yeah, but I think it depends on the institution where you want to further. Because I've noticed this other girl, and then she went straight to masters immediately. So yeah.
Wow. Okay. I think it depends on the max, I would say.
Max? No, actually, Banika, the experience, the 2 years experience.
Okay. Okay. Yeah, that's it for nursing. It's not a lot, honestly. But can you please, someone is trying to get into nursing or to get to know how to get into nursing. Can you advise them?
Okay, firstly, you're gonna need passion. Passion.
Okay.
Nursing nursing requires a lot of passion. Okay, because firstly there's a lot of hours that you need to cover, and you need to make sure that you balance your life academically, in the workplace, socially, like in all aspects. So firstly, be passionate about nursing, and then from there, Kiran, you need to work hard.
Hard work, passion, and
just dedication.
Dedication. Hard work, passion, and dedication. That's what you need to be a good nurse. What's up?